of the GPs, which is an oral item. So we're going to take agenda item 7, which is on page 41 of the papers, our original agenda, and also page 3 of the supplementary papers. There's a little bit of an update on a meeting that took place regarding the GPs going to Richmond. So I'd like to invite to the table, please, Fiona Byrne, Deputy Head of Primary Care, North Central and East London, NHS England, and also Martin Hill, who I gather is the Associate Director of Estates and Facilities for North Central and East London. And just before you give us an update, Councillor Andres Armenides has asked to speak, so if you'd like to come take the chair at the end and take the microphone, or on the side actually, and take the microphone, you requested to speak, so if you can keep your... Thank you, Andres. Comments to the comments, that's lovely, thank you. Sorry, just a moment. Everyone, turn your microphone.
Yes.
Do you want to just move those forward?
Yes, I want.
Sorry.
Thank you, Chair, for letting me speak. I'm here because many of the residents I have spoken with in Brunswick Park are tired and fed up with the fact that after 7 months the centre is ready to be used, it is still closed. Let's be clear, the situation was expected. The changes in the NHS that have to this problem are part of larger chaos caused by the government unmandated top-down reorganisation. I am, however, pleased to share with you the outcome of a conversation that I had with the Regional Director of NHS Property Services, Tony Griffiths. He said that although they haven't agreed yet, when they reach an agreement with HB, it will take them 4 to 6 weeks to move in and set up the IT system. He also said that NHS Property Service and NHS England have agreed to have a fortnightly call to push ahead with this situation. However, at the recent meeting, the meeting of NHS Property Service and GPs to discuss the list, a number of actions came out of that meeting, and they are liaising with their lawyers and those of Dr. Okongo to work through those actions. While I appreciate that the contractual arrangement between the GPs and NHS England are not within ProCorp's control, nor the Council, I believe we all have a role to play. I have raised questions to the Cabinet member asking her to press for a resolution, but sadly, it's come to a little. I have also yet to see the local MP properly engaged in the issue. As you know, last time I said that this situation is unacceptable. Now I think it is ridiculous that no agreement has to be reached and that over 6,000 potential service users, together with all taxpayers, pay $104,244 per annum to guard a closed building. Thank you.
Thank you very much, Councillor Armenides, for your comments. No doubt the two members here would like to respond at a later date. I'm just going to ask Mr. Hope, sorry, if you'd like to return to your seat, thank you. Mr. Hope to come to the table. You've also asked to speak on this item, and then we'll get some answers. Thank you.
Thank you, Chairman. I don't want to throw in a note of dissent at the beginning, but I did indicate in my email, and I had understood the rules to be that officer report would come first, so that I could address my comments to the update, because I don't want to say things that are going to end up being kind of out of date, so to speak. So I'm happy to stay here, but I would appreciate it if I could speak after the update from the officers, as I understand is the practice anyway.
Through you, Chairman, there's nothing in the Constitution which states which order public comment should come in, and it's usual custom and practice for a public comment to come before the officer's presentation, but as there's no hard and fast rules, it's at the discretion of the Chairman.
Can I ask you to speak, Mr. Hope, first, and then we'll see what has to be said afterwards?
If that's the case, I'll go and sit back down because I find it a bit silly to do that. And I'm not sure about Mr. Charles' understanding because I'm pretty clear that it does say that public comments come after the officer report, which has to be corrected.
And then last time we had you speak first. Yeah, I was just going to say that if you would like to comment, then they can comment.
Well, I don't want to waste everybody's time making two sets of comments. That was it.
Okay, is everybody happy to allow Mr. Hope to? That's fine, it's at my discretion, Mr. Hope, so you may, yes. If you'd like to sit there, that would be fine, thank you. If you would now like to make your presentation, thank you.
Yes, since we last met, one of my colleagues explained that in relation to the Brunswick Park Centre, we have met with
Introduce yourself, who are you? Sorry, I don't know who you're from.
my name is Fiona Aaron.
The name, sorry.
It's
It's got a long title.
I did introduce, the Country's Benefit, one of the names going on, I did introduce Fiona as the Deputy Head of Primary Care, North Central and East London NHS England, but hopefully you've now got the labels there. And then the other gentleman at the table is Martin Hill, Associate Director of Estates and Facilities for North Central and East London NH Property Services. So we've got NHS England at the table and NHS Property Services. All right? Thank you very much, Fiona.
Yeah, at the last meeting, my colleague Robert explained that we met with practices to discuss the relocation into Brunswick Park. At the time, there was a key issue, two key issues. One was in relation to issues that Dr. McConville had about the link between themselves and NHS Property Services, and the other related to Dr. McCarthy's expressed interest in purchasing the building. And we agreed to take that away and discuss it with our colleagues in NHS Property Services. Martin has met with the practice to discuss the lease, and he's also provided feedback on the sale of the property. As explained in the report, there are a few issues around the lease. The key one concerns the level of service charges, which the GP considers to be considerably higher than what was previously been paid, and that's causing her some concern about the viability of the practice. After the meeting between Martin and Dr. Okonkwo, I met with her LMC representative and we discussed this, and I did ask that if she does perceive the relocation as being something that will cause financial difficulties, she can put a case to us for financial assistance, and we would certainly look favourably on that as a way to resolve the situation. And I'll ask Martin to give an update on the discussions.
Just before you do, Mr. Sorry, could you just tell us the date of that meeting that you're referring to?
When I met with the LMC, it
Yes.
was a couple of weeks ago.
And that was the date of your last meeting or talk with the two GPs.
That would have been the previous meeting that we attended,
Attended.
and subsequent meeting to be with property services.
Okay, just so that everybody's very clear. Thank you.
Right, sorry, in terms of the lease,
Could you switch your microphone on, please? And if you want to move it towards you, please do. And if you want to move it on the table, they are portable.
yeah, we had an initial meeting between Dr. Okonkwo, her solicitor, legal representative, our solicitors, and myself. 3rd week of June, I can't remember the exact date, it's sitting here. And that was to discuss the final negotiations on the lease. The sticking points relate to concerns about the financial impact on their practice of moving into the building, which again is already referred to, rather than the lease terms itself. So I'm hoping that we'll get to a resolution in the near future and therefore enable Dr. Okonkwo to move into the building and commence delivering services. As was mentioned earlier, there will be a delay between us signing the lease and the services commencing because of the installation of GPIT systems, loading up the building with clinical equipment, etc., etc. Albeit that the base equipment is in the building, so consulting chairs and what have you are already in the building, but actual medical equipment needs to be procured and placed into position. We've also had interest from one of the NHS providers in the services from the building and provided information to them on the cost of the building and the standard lease. And they're considering their position, and negotiations with Dr. Carney are not proceeding because, of course, he's not interested in taking a lease on the building. So that's the position there.
Right, yes, because I gather Dr. Carney already has premises that he owns anyway, doesn't he?
Yes. Dr. Carney has premises literally just round the corner in a, not to say protection family, a semi-detached house round the corner, 1970s, 30s house.
Just for the benefit of everybody, could you just clarify whether it was just Dr. Conway who was in the practice before the fire, not Bones?
Correct. It was, at the time of the fire, there was actually two GPs in the premises, Dr. Conco and Dr. Duro. Dr. Duro subsequently retired, and his list was dispersed amongst the local GPs.
Thank you for that clarification. So, Mr. Hope, if you would now like to make your comment that you were going to earlier.
Okay, well, I'm not going to make the comments. I'm not going to make the comments I was going to make earlier because the update has cleared up most of what I would have to say, so that saved you some time. I think the only issue from the point of view of East Party Association is that the GP services are restored to the Brunswick Park Health Centre way part of this upcoming winter. I don't think residents will tolerate another winter of having to queue outside in the cold, and that's certainly our perspective. If I understand it now, what is being said, there's only now one track negotiation with Dr. Conco. That was our concern, that we were entering into some kind of labyrinthine two-strand negotiations, which would end up with nothing happening for a long time. So as I'm now, that's not happening. I have nothing more to add than I thank you for letting me put this on your agenda, Madam Chair.
It's a pleasure, thank you. So members of the committee, Councillor Mitchell, have you got your hand up, or yes, would you like to go first, then Councillor Cook?
Thank you, Chair. Could you just clarify for me, please, about whether Dr. Hooper will be the only doctor there, and will there be empty space left in the centre because Dr. Carney isn't moving in, or will the only doctor moving in have all the space that be occupied?
The building was slightly enlarged during the refurbishment works, as well as considerably improved from an operational viewpoint, so that it is capable of getting a greater throughput of patients than was originally the case in the existing building. And that was deliberately incorporated into the design so that other services could be provided and the practices could expand and extend the range of services delivered from the building. In answer to your direct question, there was room for a certain number of patients, which, however you split it down between the GP populations, either 2 or 3, depending on the number of patients on their list. And therefore, Dr. Conco would merely be 1/3, 40% of the potential. The other party that's in discussions at the moment would take roughly the same space as Dr. Carney would have taken. And that would have still left one consulting room for out-of-hospital services and whatever was being commissioned in the building, or space for another GP, whatever. So there is, in answer to your question, yes, to get maximum use of the building, it does require more than Dr. Conco to be in the building.
Councillor Cook, you wish to ask a question?
Yeah, I too was puzzled by the capacity of the building against the number of people who are in negotiation here. So even if the negotiations with Dr. Conco, was it? I've said that correctly. If that's successful, you've still got a single-handed GP in a building that can accommodate at least 2, maybe 3. So, have I understood that correctly? And if so, what's happening to fully utilise the building and get value for public money?
I think, as we've already alluded to, we're having discussions with another GP who will be leaving the premises quite soon to look relocated into the building. Once the two practices are co-located, we will do some development work with them so they can grow their lists, and that will take up some of the capacity, and there's potential to do that, and also to expand the services that they're offering at the moment, so we do get that full utilisation. And that will be part of the driver behind the financial systems we provide.
The situation's been known for not just months, is it? I mean, when it broke down quite a long time ago, a decision was made about extending it and refurbishing it and making it available. So why are we in this situation so far down the road?
The fire was actually in January 2010. There was various, before my time, before NHSPS time, there were various discussions around for alternative healthcare provisions in that area, which resulted in a delay, let's be honest, that's the building was starting. Eventually they did start and they said it would complete in January. The issue around the timing is, yes, we rebuilt or refurbished the building to primarily to house Dr. Concro, which we were obligated to do after the fire, she was tenant in the building. It was therefore to provide space to develop, I won't say GP club, but a more concentrated gathering of GPs in order, I'm talking probably do tonnage, if I'm cutting into your area. But the principle was to be able to grow and therefore get some sort of economist synergies at scale between the GPs. But as you know, the GPs are private practitioners, and if they, we can't make a third party do what they don't want to do. Sorry.
Yeah, I think we had to conclude the discussions with Dr. Canning on whether or not he wanted to move in, and he's made it clear that he will not move in under release, and for that reason we're now seeking an alternative to move in, and it will be a strategy we develop once they've moved in.
Just want to say one quick comment there that, as you said, you were, the last time you came to the table, you were having to pursue the two, the Conquer and the Carney, so obviously now the news is that the Carney has dropped out, so quite probably you couldn't then negotiate with somebody else until he had made his mind up, so it's obviously now very clear that he has withdrawn. He, I presume, will, sorry, I'm making a presumption, will stay in his present premises. And obviously if Dr. Okonkwo moves out, he will have much more space, her space as well in his present premises, which he owns, and that she will then be moving back into the health centre with another GP, and then still the possibility of having some other, either a third or some other facility put in. I know you mentioned the physical building, you mentioned enlarged, actually the physical building hasn't enlarged. I think we had this. The physical footprint of the building.
Yes.
That's fine, okay, that's corrected. I thought last time we were told it had been reconfigured internally to make it far more efficient.
We actually did extend the footprint of the building in order to maximise the usability of the building in the waiting area.
Thank you. Councillor Rawlings, you just had a question.
Yeah, it's good that we look like we're going towards a conclusion. There's a couple of points. One is on the service charge. Is that done on the building or per GP? I'm just thinking, was that the problem? That if only one person moves in, they have to pay the whole service charge for the 2 or 3, or is it per unit?
Traditionally, it's apportioned by. Sorry, is it? Thank you. Traditionally, it's apportioned by the occupation. So if they occupy 40% of the building, then they will only pay 40% of the service charge.
That's fine. The other point is. And Councillor Ioannidis mentioned it, there's a security cost, I'm not sure who's paying, but I know the CCG have to pay for empty space. So at the moment, where does the security cost come from? If a building is only 40% full, does that mean the CCG, by GP commissioning group, still have to pay the rent on the void space?
Yes, I understand the void space in this building.
So at the moment, somebody's paying, I don't know who's paying for, somebody's paying for security, which may be NHS England or PropCo, but NHS England, because it's for GP, plus the CCB are paying rent on the empty space at the moment, are they?
Yes.
So the cost is more than 104,000 a year per annum that the security, well, they're not going to go a whole year, the security. There's also the rent being paid, so in fact we're probably paying, I don't know, probably over £200,000 a year, when a year, on an empty building. That does seem ridiculous given the difficulties the health service have got with resources anyway.
Yeah. I mean, at the moment, NHS Property Services are providing security and obviously paying the rates and the minimal utility costs in just keeping it, frankly, just aired and warm over the winter period. So we will not be, we're only passing on those costs that we're incurring in terms of the void space. And we hope to obviously minimise that void space. I think everybody has to acknowledge that we don't want to be where we are.
Obviously, the costs go down, the sooner you can get Dr. Okonkwo back in there. Sorry, could you turn your microphone off? So, back into the premises, and if there is this real possibility that there's obviously another party now interested, which I think the committee will welcome as extremely good news, and hopefully this will be very positive. That if you've got at least 2 GPs and now you're back where you were before, with still a little bit more space to be utilised to the benefit of the patient. Sorry, yes, do you want to?
So, yes, I mean, if all of the current intentions, everybody in effect will be back where they were before the fire, so Dr. McConnell will be back in his own premises without Dr. Okonkwo will be in the building, and there'll be another GP providing services from that building, and with scope for improvement, as Fiona mentioned. So we just have to get to that stage, because I don't know how many of the committee here have been inside and seen inside the building. I know one of your fellow councillors, ward councillors, have been inside it. I think it's actually an excellent building, and it needs to be used.
Right, Councillor Hook, sorry. And Councillor Sharma.
I'm a bit concerned that we seem to be working towards having 2, maybe 3 single-handed GP practices. I just wonder whether somebody can comment on whether that is a sort of configuration which is favoured in the National Health Service at the moment, because I thought we prefer to have group practices which have economies of scale.
The 2 practices moving at the moment are independent, and I think moving forward, if we wanted to get them to integrate, that would be a piece of development of what we would have to do with them, you know, to get them to work together. This is something, an arrangement they will have to come to, and hopefully by being in the same building and looking at the economies of scale by merging their practices and their system, that's something that can be facilitated.
Councillor Sharma.
Council will ask my questions, so that's fine.
Right. Well, I think just to add to this, I know that Councillor Ioannidis very kindly came to speak this evening, and obviously since you became a councillor last year, this has been obviously a concern. I'd also like to, on the committee's behalf, Councillor Tamburidis, and I know that Councillor late Lynn Hillen and also Councillor Rutter have been helping to facilitate and working behind the scenes, particularly Councillor Lynn Hillen when she was leader of the council, in facilitating and hoping to smooth along the rebuilding of the building, which obviously took some time. So I think all 3 ward councillors have been absolutely spot on and on the ball here. I'd also like to thank Mr Hope from the Residents Association as well. I think tonight has been far more positive and a great step forward, providing obviously what you have expressed for the 2 moving back in. And I just wonder if Councillor Hart wants to come and say anything else about. I'm just wondering where we put this now, and whether or not the committee want to consider asking Councillor Hart if she'd like to put it on the Health and Wellbeing Board now, just to monitor where it's going. So perhaps you'd like to discuss it, and then we can decide what we're doing with the item. Thank you.
Thank you, Madam Chairman. I think the only point that I would want to make, and I do think this evening has been very positive, I won't be answering individually the points raised by Councillor Iron. He's raised the same points in his council questions. I should be answering them then. I should point out that as far as I'm concerned, the failure to reopen the Brunswick Park Health Centre and, in fact, another item that we're going to be looking at later, to utilise the GP space at Finchley Memorial, both estates issues, which do need to be resolved. Not by us, not by scrutiny, but by NHS England together with Properco. Now, both of these situations, both at Brunswick Park and at Finchley Memorial, have significant implications for Barnet residents and the CCG. The CCG, I believe at its board meeting this morning, noted that the liability falling to them arising from underutilised estates could be in the region of as much as £4 million per annum. And so on that basis, I'm very happy for the Health and Wellbeing Board to be tasked to examine the progress that's being made to address the wider estates issue, particularly bearing in mind the necessity for a resolution on it in order to deliver on the CCG's recovery plan. Now, with NHS England being members of the board together with the CCG, I agree that the Health and Wellbeing Board is well placed to look at how the wider NHS estate is used to support the delivery of the health and wellbeing strategy and, as a consequence, deliver value for the taxpayer, but much more importantly, to ensure the financial viability of the CCG.
So before we make a decision on Brunswick Park, would you like to just give us a very quick update? I think in the supplementary papers you were just mentioning a bit more about the meeting that took place on the 19th of June, about the two GPs moving into Finch Memorial, and then we'll wrap the whole item up together. Thank you.
Yes, we met with the two practices on that day to discuss one of their concerns about what had happened to date, and we explained to them where we were in terms of agreeing the financial assistance package, which is being provided by the CCG via NHS England, because we're the only organisation who can provide financial assistance to GP practice. We explained that with that not being resolved, in order to move the practices in, we wanted to put in place what effectively is a task and finish group, which will facilitate the organisation in, and that will involve the practices, property services, CHP and the CCG. And it will have two functions. One is to move the practice in, and then secondly to gain support of this practice in developing their integration once they're in the building, because they're keen to perhaps not merge the two practices, but to work more closely together to leverage economies of scale and good practice. It was a very positive meeting, and we've written to practice today to outline how we want to set up the task and finish group, and hopefully that will be something we can take forward quite soon. And we've also discussed the likely date for them moving in, and it will be approximately 6 months, but they're going to look at what will be the best date, or potentially what will be the least disruptive date for the move to go ahead. And obviously within that there will be quite a lot of significant engagement with their patients, explaining how it's going to happen.
We're also commenced a working group, for want of a better word, with community health partnerships with the actual owner of the Memorial Hospital, and we're hoping to involve the CCGs in terms of looking at the estate utilisation within the area, and and looking at positions that we found on the 1st of April. So we are aware of the issues around void space, and obviously it's keen to be involved with the Commissioner, both the CCG and NHS England, in terms of dealing or trying to address as far as possible those voids.
Councillor Rawlings, Councillor Sharma, just quickly.
Well, it's just very guilty still with concerns about the CC money being spent on empty space, but that's where we are, but the quicker it's sorted out, the better. I do believe 50 more or less there's room for far more than two 2 GP. Just want to check if it's owned by community health properties or whatever.
Health
CHS.
partnerships, sorry.
But health partnerships. Even though it was paid for through the lift scheme, I thought they had a separate ownership, or I got that mixed up.
Sorry. In the Health and Social Care Act, the lift properties went to community health partnerships ownership, not NHS Property Services ownership. We act as agents for them in terms of tenancy relationships and in dealing with the software and services like catering, but they provide the manage the lift contract. So just the clarification.
So are they 2 separate property, estate owning, if you like, companies within the health service now, as well as those that are owned by individual GPs?
Yes.
Oh, I love simplifications. Reform.
Councillor Sharma.
Yes, again, I don't understand delay on delay on delay. Finchley Memorial didn't open last week or last month. It's been planned for years. Surely someone somewhere sits down as a team and says, at such and such a date, a new hospital is going to be open. We've created facilities, very, very good. I saw it. We've pre-opening and opening. Wonderful facilities on the ground floor. We've known for a long time that we needed people going in. But I'd like to know why it takes us so long. And secondly, somewhere in all the accounts, and particularly the control of the cash flow and P&L account, presumably a service charge would have been applied to the people that were using that space, GPs using that space. Who's going to pick up the cost of no one being there over the period of time that's now been empty, until we actually manage to find people to go in there? Who picks up the cost? And what is the cost? On your service charge. Somewhere you've got a schedule that says the income coming in is coming from here,
Because it's not our building, I'm sorry, I can't give you that information. I can find it out, but I can't give you that information. With my memory. The difficulty historically has been that, unlike our future actions, we've not signed an agreement prior to constructing these facilities. And in the case of Finchley, a number of changes we don't have High Westgate, so we don't have key tenants. Policy never did, and we will be doing in the future, so we don't end up in this position again. And what tends to happen, obviously, is that healthcare systems change in the building process, other initiatives come into place, and what we actually end up with doesn't keep track of the requirements in the future. We're also vulnerable to people then seeking commercial advantage out of the position that we're in, and therefore that's how we end up in this position. It's not a position that we will be entertaining in the future, because I think as part of our NHS Property Services brief, we will be looking for a customer in order to guarantee before we will involve on these large projects. So hopefully that assists in not dealing with the past, but hopefully dealing with the future.
But still like to know who's on the P&L accounts going to pick up the deficit of 9 months or whatever the period of time is that something is soon actually be occupied and going to be empty.
As a board, I'm assuming that the CCG is going to be picking up that cost, but I can't tell you what the cost is because the state is not our building. Sorry.
And certainly as NHS England, we've only been in existence for 3 months, and we're looking at the processes for improving business cases in the future, and we will be making getting assurance that we're not going to put in a position where we develop certain properties on behalf of GP practice, and then as we reach the point of occupation, and they decide that they don't want to move in. So we'll be looking at making sure that that is something that is addressed within the business case, because there has to be a proper reason for us to invest funds and to develop the service and for the practice. And we're feeding that up into the national decision-making.
Chair, I know you want to wrap this up. There's just 2 points that I really feel the urge to make, if I may. The first one is that in the case of the borough of Barnet, the residents of the borough are growing, in actual terms. You can see the growth over the last few years. And we have, thankfully, an ageing population because we're all living longer. So we now need more GPs than we've ever needed before in the borough. So I'm really, I hate to say it, as a businessman, can't understand where the blockage actually is. It's not as if we're creating a need for something, where the need is actually there. And if I was doing something, I'd say, well, let's give them no service charge for the first year or 18 months so that they can move in and get started and get themselves sorted out and add value to the borough. I still can't see where the problem is. Thank you, Chair.
I mean, certainly we're looking at the whole package of moving somebody into the building, particularly where the purpose of that relocation is to expand services, be that increased access for patients, or to provide the other hospital services that the CCG wants to commission. You're absolutely right, there will be a point in time where the space that we develop will be greater than the service we initially move in, and that is where, as part of the business case, we will be looking to realistically identify what those costs were and who will pick them up, so we don't come to the point just before when the building is ready and somebody doesn't want to move in, and I think that's why we're going to get much more realistic business cases in the future.
Fine. Thank you. Sorry, Chair.
No, that's all right, thank you. So, if with the committee's agreement, I think because of what you just mentioned about the CCGs and the impact on that, that they also sit on the Health and Wellbeing Board, that to me, with the committee's agreement, is the place where we should be recommending that we put this. So if I can put it to the committee that that's what we do, and Councillor Hart, thank you very much for agreeing to put it on the Health and Wellbeing Board, and hopefully that's a satisfactory outcome now to this scenario, not only from the residents' point of view, but obviously from the doctor's point of view and speeding things through. So, and I'd also like to just thank you, Councillor Hart, for all that you've been doing as well over the years since the fire to speed this one through, as well as the 3 water councillors. Thank you. And if you'd like to comment, or are you happy with that?
Perfectly happy with that, thank you very much. I look forward, as I said, to taking these whole estates issues through the Health and Wellbeing Board, because it really is of vital importance to the CCG.
Yes, absolutely. And if, thank you very much, both for coming as well. And just for the public's benefit, the Health and Wellbeing Board is open to the public. The public can come to that. Very welcome to every single meeting. They meet very regularly. You will find all the details on the Barnet website. So,
I'll give you the dates, Mr. Chairman.
And
9 o'clock.
our gold
9
star
o'clock in the morning.
councillor here, member of the committee, will be giving you dates, Mr. Shepherd.
It gets very early.
So any of those the public want to come and see how this is now progressing, I'm sure Mr. Hope will have an interest.
Yes, if they get breakfast, we get breakfast. We get breakfast.
Thank you all very much.
Of course, the Brunswick Park and Memorial
Yes, both items, because they're both tied in, it's GP services moving into properties that need to be filled. So I think we've found a very satisfactory outcome for residents and councillors and everybody else.